All right, here we go. Hello, and thank you for watching this presentation on the best personal injury CPT on ICD-10 codes. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information in this presentation is for educational purposes. It's not intended to be a substitute for your thorough clinical decision-making. It's not intended to be legal advice. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it is not guaranteed. A little bit about myself. My name is Dr. Marty Kotlar. I'm the president of Target Coding. I am a chiropractor. I practiced for many years, 16 years, and about 12 years ago I started a company called Target Coding. I'm also a certified professional compliance officer. I'm a certified billing and coding specialist. And I consider myself a little unconventional. Most chiropractors are not certified coders. Most certified coders are not chiropractors. So I take this unique approach. Being in practice for many years, I can take the clinical approach, apply that information to my clients, assist them with the clinical approach, but more importantly, explain to them how to be compliant as it relates to billing, coding, documentation, Medicare, and HIPAA. Those are the 5 things. When you hear someone talk about compliance, you should be thinking about those 5 things. They're 5 separate and distinct items you need to be compliant about. If you want to throw in a 6th one, you could add OSHA. But as far as compliance goes, it's billing, coding, documentation, Medicare, HIPAA. You want to add a 6th one, OSHA. And that's what we specialize in assisting chiropractors, acupuncturists, physical therapists, medical doctors, massage therapists on how to be compliant. I've written many training manuals on billing, coding, and documentation. I write articles to numerous publications and journals throughout the country. I'm a guest speaker at many state association conventions nationwide. All right, now let's begin with today's presentation, the best personal injury codes. Now, many people seek care for chiropractic services as it relates to injuries. Auto injuries, on-the-job injuries, many other types of trauma. Now, when I say PI, most chiropractors and staff members think auto accident, which is fine. That's what you may see in your practice. However, personal injury could be, I was involved in many other types of personal injury cases. For example, you could have a patient or a person is on vacation at a hotel, and the lobby of the hotel is slippery. Patient slips and hurts their back, hits their head, falls on their shoulder, comes to seek treatment from you. That's personal injury. So many types of injuries that are that occur to patients, soft tissue types of injuries, are seen by chiropractors. Soft tissue contusions, pain, ligament laxity, stiffness. So those are pretty common conditions seen in a typical chiropractic practice after a personal injury. But then some of these conditions can get complicated and complex, like sleep disorders and dizziness and headaches and visual disturbances. So you want to be aware of how to treat those. Some of the doctors I work with, they have no interest in the PI market. Just yesterday I was talking to one of my clients. One of her good patients' daughter was in a car accident. She doesn't want to treat personal injury. She doesn't want to be involved with it. It's her choice, right? Many of you might be thinking, why? That's all we want is personal injury. This particular doctor is just not interested in dealing with attorneys and not interested in possibly being deposed and have to go to court. So she doesn't treat personal injury patients. So it's everybody, every practice approaches it differently. I think it's a good idea to have a nice mix, so all your eggs aren't in one basket. All right, let's move on. Now, who can provide services to PI patients? QHPs and clinical staff. So QHPs are you, chiropractors, medical doctors, physical therapists, nurse practitioners, massage therapists. These are QHPs are qualified healthcare professionals that have been trained, licensed, and can report services provided by those individuals to insurance companies for payment. Clinical staff is different. Clinical staff are also trained individuals, but they cannot report services directly to an insurance company. They may even be certified, but many of these individuals are staff members that work under the supervision of a QHP, like CAs and athletic trainers and medical assistants and rehab techs and Pilates instructors and aides. You could have a CA who is also an orthopedic surgeon working for you, but they're not acting in the role as an orthopedic surgeon if they're just assisting you and working under your supervision. Supervision is also important. There's 3 levels of supervision: personal, direct, and general. For my physical therapy friends, remember, if you're billing Medicare, if the PTA is providing the service, the PT needs to be on site. That's called direct supervision. So these supervision rules can be complex. Sometimes they're hard to find. In some states, CAs are not allowed to perform any services at all. Make sure you're aware of that. And that, there's more and more scrutiny on the services that are being provided by healthcare professionals in general. So insurance companies are aware of these things, and insurance companies feel that they shouldn't have to pay for a service if it's not delivered properly. If you're in a state where your CA is not allowed to do electrical stim or put a patient on traction or do ultrasound, and you're doing it, and the insurance company finds out, you're going to have to give back a lot of money. And it's also embarrassing for the attorney that's working with you on the case, so make sure you're following all the rules. Check with all the health plans on supervision requirements prior to billing. Inquire as to who needs to be on premises when the procedures are performed. All right, now let's get into the most common diagnosis codes that are seen by PI practitioners. Sprains and strains. Oh, of course, we're going to see a lot of that. Sprain and strain codes are trauma-related codes. They begin with the letter S. And there's also 3 encounters involved with these codes: initial, subsequent, and sequela. So A is initial encounter. You're going to use this when the patient is receiving active treatment for the condition and you're the first provider the patient visits. D, subsequent encounter. You'll use this for follow-up visits after the patient has seen another provider. And the letter S is used for a sequela. So let's say the patient comes in with, Mr. Williams is in a car accident. He hurt his back in the car accident. And he comes to you initially, so you're using the letter A, right? Initial encounter. Then a few weeks later, he develops sciatica or radiculopathy, a type of pain down the leg, and you feel it's a sequela. It's a late effect of the original condition. That's where you would use the letter S. Again, if anybody has any questions, just email them to us. You could email them, of course, to info@targetcoding.com, but during the webinar, just in the chat box, just type your questions, hit send. I'll get to them at the end. Would you like to grade your sprains and strains? Well, here's one way to do it. 1, 2, 3, minor, moderate. Grade 3, complete tear. Strains, grade 1, 2, and 3. So attorneys, and when you're dealing with PI, you have to be prepared to deal with lawyers. Now, lawyers want to make money just like you want to make money. The more injuries, the more suffering that the patient has had, the more, the higher, the bigger the settlement. I mean, it's just the way it is. And the bigger the settlement, the more money the lawyer makes. So they're interested in knowing exactly what's going on and how much the injuries are affecting the patient's activities of daily living. So here's sprains relate to ligaments, S13.4. Strains relate to muscles. Lumbar sprain, S33.5. Lumbar strain, S39.012. Make sure you know how to diagnose sprains and strains properly. I'll get into that a little bit later. And there are S codes that relate to subluxations, the traumatic subluxation codes. You should see them on your screen right now. They get very specific. They, again, are S codes, which means injury, trauma, and you have to supply the appropriate encounter, initial, subsequent, or sequela. So it's a little bit more complicated than the regular subluxation codes, which I'll show you in a few minutes. Next, are you comfortable diagnose a patient with traumatic brain injury? Once you get into the PI world, it's serious stuff. You might get deposed. You might have attorneys, defense attorneys, asking you questions about your diagnosis codes. You want to seem like you know what you're doing. You don't want to just throw things out without knowing the real reason why you came up with the diagnosis. So traumatic brain injury, these are S codes. Remember, codes that begin with the letter S are your sprains and your strains and your contusions and your TBI and your concussions. So here we go. These are the TBI. Now, the TBI codes are determined based on the amount of time the patient loses consciousness. Concussions. So what's the difference between traumatic brain injury and concussion? These are the things that you should be aware of. If you're getting into the PI world and you want to, be looked at as, a PI expert, where patients and attorneys and other chiropractors are referring patients to you for your work. So get good at it. Make sure you know the difference, the clear difference between concussions and TBI. You may want to take some courses on that. This is not what we do here at Target Coding, is teach you how to be, the best clinician. We teach you how to be the best coder, the best at documentation. So you want to learn how to, really get good at these diagnosis codes. Headaches, yeah. I'll show you a few things about headaches. There's all different types of headaches, but make sure you know the difference between with aura, without aura, intractable, not intractable. You see, these codes have choices. With aura, without aura. What's aura? That's that perceptual disturbance that occurs before the headache even begins. I always ask patients, so, Mrs. Jones, I see you're complaining of headaches. Before the headache starts, do you feel like unpleasant smell? Do you have like a confusing thoughts, smell unpleasant smells, see strange lights, you feel like you're getting a little foggy? Some patients would go, wow, Dr. Kotlar, how did you know that? Yes, I could tell when the headache's coming on before it even starts. So then that's with aura. Another good question I would recommend you ask. You see, I dabble into the clinical aspect because of being in practice for so many years. But again, I don't want to give the impression I'm the clinical expert. I'm the coding guru, yes, the compliance geek and expert, sharing some clinical things here when it comes to intractable. I wanted to figure it out. So the question I would ask, so Mrs. Jones, when you get your headaches, what do you do for them? And the patient goes, Dr. Kotlar, some patients would say, I've tried everything. I've tried, sometimes patients would get angry. I've tried everything, Dr. Kotlar. I've tried over-the-counter medication. I've tried prescription pills. I've tried Botox injections into my head. I've tried acupuncture. Nothing helps. Well, that's considered intractable, hard to control, difficult to treat. Status migrainosus affects only about 1% of migraine sufferers. This is where the headache lasts more than 72 hours. The patient might be vomiting, getting dehydrated, may even be hospitalized and be put on IV medication. So make sure you know which diagnosis codes to choose. Here are tension headaches, menstrual headaches, cluster headaches, cough headaches, menopause headaches associated with sexual activity. Here we go. Post-traumatic headaches. There are two sets: acute post-traumatic headache and chronic post-traumatic headache. Which one are you going to use? How do you know which one to use? Don't just wing it. You need to know. Well, listen, my feeling is you should know. You should really know. When you're placing a diagnosis on a patient, you're labeling a patient with a diagnosis. It sticks with them. So it's important to choose the most appropriate diagnosis. Just like if you went to a doctor, you wouldn't want to be misdiagnosed. So how do you know to choose acute or chronic? The answer is the amount of time the patient has had the headaches. And the threshold is typically 3 months, which makes the difference. Here are the regular subluxation codes, the M99 codes. If you use these instead of the traumatic subluxation codes, I think the reimbursement would be the same. And now we have neck pain, and simple neck pain and thoracic pain, spasm, pretty simple codes. How about disc disorders versus disc displacement? So a disc disorder means there's a nerve root compression with radiculopathy. This patient has a herniated disc with pain down an arm. At C5, C6, go with M50-122. Next, patient comes in and says, I just have neck pain. No radiculopathy, no nerve root compression, no myelopathy, but the patient has a bulged disc at C5, C6. I'm going to go with M50.222. So make sure you know the difference between a disc disorder and disc displacement. Now in the lumbar region, the levels aren't as specific. Now, I got this question asked all the time. Dr. Kotlar, with disc disorder and disc displacement, can I diagnose a patient with those codes without imaging? Again, I'm putting on my clinical hat. I say, no, I would not use those without imaging. Now, if you want to use something without imaging, go with radiculopathy. So patient comes in with neck pain radiating down the arm. You don't have an MRI. So you don't know if there's any type of disc involvement. You can go with cervical radiculopathy, M54.12. Patient has pain down a leg, lumbar radiculopathy or sciatica. There's another thing. Speak to quite a few doctors at seminars, and they say that they do not know the difference between radiculopathy and sciatica. They would not be able to explain to me. It's nice they're being honest with me. They don't know how to differentiate between sciatica and a lumbar radiculopathy. So make sure you know how to do that. Very important. Don't just use diagnosis codes because your friends told you to use them, or I'm not having a problem. That's another thing I hear, which is dangerous. I've been billing the same way for the last 10 years. No problems. Okay, that's fine. It's like driving on the highway. The speed limit is 70. You're driving 80 and you get home. No problem, right? No problem. Unless there was a cop on the road that clocked you and now you get a ticket in the mail. No problem until you get something in the mail. So when I speak to doctors that are being audited and they get the letter in the mail, dear doctor, we are requesting to see notes on the following 25 patients for these dates of service. Now, wait, no problem, right? You've been billing for years, no problem. Just send in the notes, right? There's no problem. Yeah, pause, right? All of a sudden, there could be a problem. Now you send in your notes, and now you're asked back for $50,000. All of a sudden, there's a problem, right? So make sure you're using the right diagnosis codes. Like here, sciatica M54.3, I would never use that. Sciatica unspecified, I would never use that. Is it right side or left side? Get specific. Now, if you're going to diagnose a patient with a sacroiliac joint sprain, do some ortho-neuro tests. Yeomans, Ganslins, those are the gold standard tests. You diagnose a patient with an SI joint problem, and now you're deposed, you're being questioned. The things I teach are all proactive. It's all being, not caught off guard. You don't want surprises, right? Very proactive. Learn how to substantiate the codes you use. You're going to diagnose a patient with cervical radiculopathy. I just mentioned that code, M5412. What do your notes show? How did you come up with that? See, years ago, when patients would come into my office, I didn't know what I was doing. Patient said, oh, Dr. Kotlar, I have back pain and I have pain down my leg. I would just diagnose sciatica. I didn't do anything to justify it. That's wrong. That's incorrect. That's not proper. Standard of care. Even if it's a cash patient comes in with pain down the leg, you should differentiate between sciatica and radiculopathy and bulge versus herniation. Again, at least that's my opinion. So do Jackson compression, check reflexes. This is a page out of a book that I recommend all doctors have, great for staff too. This is a page that's out of Chapter 3, where it gives a whole bunch of diagnosis codes and then the ortho-neuro-chiro test to support it. It's an excellent resource. It's an excellent guide. So here, cervical brachial syndrome. Okay, you're going to diagnose a patient with cervical brachial syndrome. That's M53.1. Do a quick check here. Look at the ortho, neuro, chiro test that you should do. Yeah, this is the book that I'm referring to. It's an excellent book. It's called The Best Chiropractic ICD-10 and CPT Codes to Improve Reimbursement. It's got cheat sheets. It shows you which diagnosis codes pay the most visits. I'll talk a little bit more about this book later. How about ligament laxity? The doctors that I work with that do a lot of PI, oh wow, this is one of their favorite codes. Attorneys love this code. But it can't just be, oh, patient was in a car accident and patient had neck pain. Okay, ligament laxity, M24.28. No, you have to do certain things to justify it. It's not just based on a patient history where you can come up with that diagnosis. How about cervical kyphosis? This is where the cervical curve is actually going the other way. Of course that could happen in a car accident, whiplash, hyperflexion, hyperextension. Look at that. That's M5292. How about sleep disorder? Patients would come in actually quite often. Dr. Kotlar, before the car accident, no problem sleeping. Ever since the car accident, I'm tossing and turning. Every hour or two, I'm getting up. I don't sleep soundly through the night anymore. What is going on? Probably related to the car accident. Depression, anxiety, tinnitus can occur after a car accident. Very good diagnosis codes. Dizziness can occur after a car accident. It's only 3 digits, R42. You want more? Look at these. Jaw pain. Could that happen after a car accident? Absolutely. Patient hits their head against the side window, or the airbag hits them in the head. There's your contusion of the head and neck. Nausea, absolutely. Pins and needles, numbness, tingling. After a car accident, the patient has abnormal posture, weak muscles. How about the seat belt? The seat belt causing a contusion in the front of the chest and the thorax, the rib cage. There you go, S20.211. Shoulder swelling, knee contusion, just lack of energy. You want more here? Oh, this is an update. Here's an update on the diagnosis codes every year. October 1st, codes get updated. Hundreds were revised, deleted, added. There's only one, in my opinion, out of the hundreds of updates and changes and deletions and additions, only one, in my opinion, relates to chiropractic. It's the M79.1, which got expanded to a 5th digit. So don't use M79.1 anymore. That's myofascial pain, myalgia. If you're going to use that code, make sure to add a 5th digit. You always have to code to the highest degree of specificity because of the new law, MACRA. So there are the 4 new codes you see on your screen. If you have questions on that, let us know. Go through some CPT codes. Do PI patients need modalities? Of course. Initially, if there's swelling and inflammation, go with cold. There's mechanical traction, unattended stim. The top 3 are the most common supervised modalities. These are not time-based codes, and they're not one-on-one. We have constant attendance modalities. The one on your screen there, you see 97035. That's the most commonly one used by chiros and physical therapists, but this is a constant attendance modality. It could be billed in units. It does require one-on-one patient contact. Any of you do vibration therapy? You have a vibration platform? If you do, there's no code for it. If you're billing for it, be careful. You get audited, you might have to give all the money back. If a patient is just standing on a platform, there's no code for it unless you want to use the unlisted modality of 97039. You have a dry hydrotherapy bed? What can you bill for that? There are some doctors that are billing massage and heat and vasopneumatic. They're billing all kinds of codes for this. In my opinion, it's 97039 or heat. Some insurance companies have problems with handheld devices based on what you're billing, so be careful. Some doctors are using handheld instruments and billing it as manual therapy. Manual therapy is typically hands-on, so a little heads up on that. Therapeutic procedures. This is one-on-one, each 15 minutes. You have to show that you are applying clinical skills, and whatever you're doing is improving function, like therapeutic exercises. It's used to develop strength, endurance, range of motion. It's an active procedure. The patient must be doing the procedure, not you, the patient. Weights, balls, bands, tubes, the patient is doing the work. Contact foot levelers by their nexus, baxis, their triflex. It's the easiest low-tech rehab equipment, easiest to set up. You'll be up and running in 20 minutes. You don't need a lot of equipment. It's up to you. When I first started billing for therapeutic exercises, I had the patient lying on the floor. I didn't even have any equipment. And then I got fancy and I got all kinds of weights and balls and bands and tubes. I bought this $10,000 exercise machine, but I was able to bill the same code just by the patient lying on the floor. I just had to sell a little bit of the sizzle. How about NMR? Improve balance, coordination, kinesthetic sense, posture. You see, patient has to be, this is an active procedure. The patient has to be doing something. If you're doing, here, manual therapy, that's passive. You see, the patient is just lying there doing nothing or sitting doing nothing. That's a passive procedure like manual therapy. Don't do it in the same anatomic site as the manipulation. It'll get bundled. That's why if you do it in a separate site, you need the 5-9 modifier. That's all because of the CCI edits. Again, it's passive. Chiropractic adjustment is passive. Mechanical traction is passive. A hot pack, a cold pack is passive. Understand the difference. Therapeutic activities is active. The patient is performing, they're actually reenacting what's their problem is. So if the patient says, I have trouble bending, lifting, I see that in a lot of software programs. In many of these, chiropractic EHR programs, on the initial visit, the doctor is clicking. The patient has problems with bending, lifting, reaching, carrying, throwing, sleeping. I see all these things being checked off. And then if you're audited, you send that to the insurance company, it's junk. It means nothing to them. So revise your notes. If it just says, patient has problems bending, lifting, reaching, carrying, and if you're just doing an adjustment, okay. But if you're doing any rehab procedures, it's not going to make sense. If you're audited, you'll have to give the money back. Now, sometimes patients are in car accidents, and they also have Medicare. So you might have to bill Medicare. Secondary, right? So let's say State Farm is primary, and the patient also has Medicare. And after State Farm says, oh, we're not paying anymore, the patient or the patient's attorney might say, well, now bill Medicare. Oh, okay. So Medicare is now secondary on the PIP claims. You need to be very careful. You see, we teach compliance here at Target Coding. We are your goody two-shoes, so to speak. We teach compliance. We teach regulations, laws, rules, guidelines, all the boring stuff. But this is what keeps you in line. And it is what it is. We just teach it. We don't make up all these rules and regulations and guidelines. We're not into them. We're just really good at explaining them and teaching them and making them practical so you don't have to get too stressed out about incorporating HIPAA. Who likes HIPAA? Who wants to deal with logs and templates and training? Nobody, but that's the way it goes. Who wants to sit in traffic, right? That's reality. Who wants to get, delayed at the airport because, you have to go through security and you get pulled over and they go through your luggage, Who wants to deal with that, right? It's part of reality. Who wants to deal with laws, rules, regulations, filling out forms properly to get paid? Hey, that's the way it goes. So don't get too stressed out over things not being the way they used to. Be positive. Do whatever you have to do. And get more new patients in the door. So when you're billing Medicare, the point I'm trying to make here is I got off a little bit off topic there is you have to be totally transparent and be truthful when you fill out a 1500 form, especially when you're billing Medicare. So now you're billing Medicare because the patient was in a car accident. Look at box 10. You have to check yes. You're billing Medicare. You have to check yes to 10B. And then when you get to box 11D, you have to tell Medicare, yes, there's another health plan. And if you answer yes, it says it right there, complete 9, 9A, and 9D. So this is what it would look like. So Medicare says, yeah, send this to claims, but make sure everything else has been exhausted. Regular insurance, PI, no fault, work comp. All right, just want to end today's, before we get to questions and answers, I just want to end today's session by going over Target Coding's 9-step action plan. Step 1, get proactive. It's the only way to prevent problems. If you're into prevention, then you'll get proactive. I would say only 30% of the chiropractic profession is proactive. 70% sit back and go, well, I think I'm doing things right. I haven't had a problem. I'm winging it. I don't really go to seminars. I don't know. I'm doing what my friends tell me to do. That's not being proactive. Proactive is going to seminars, going to webinars, getting your CE courses taken care of, and doing a few other things like step 2, get all new patient forms signed. Make sure all those forms are, when a new patient comes in, they have to fill out forms. Make sure they're completely filled out. Step 3, review all the new patient paperwork prior to seeing the patient. There's a lot of forms, new patient forms, financial forms. With PI, you have your lien and letter of protection. And by the way, all the forms you see on your screen, we sell a forms packet. So you don't have to go crazy trying to figure out, oh my God, where am I going to get all these forms? Dr. Kotlar's saying I need all these forms. Where do I get them? Relax. We have all these forms. If you have them, great. We have them too. You have a HIPAA notice, authorization to release information. So get all the forms out of the way. Here's our HIPAA notice. You want our HIPAA notice? Send an email to amy@targetcoding.com. She'll send you this sample HIPAA form. Step 4, review the policies from the insurance companies you bill the most. Think about the insurance company that pays you the most money. What do they need? What are their policies? Let's say Blue Cross Blue Shield is paying you, I call it the 35% rule. If you're collecting more than 35% of your income from one particular insurance company like Blue Cross Blue Shield, find out what their policy is on chiropractic. I am shocked when I hear this. Dr. Kotlar, hi, I'm being audited. I'm being requested to send in my files on 25 patients. Or Dr. Kotlar, I sent in my records, and now the insurance company wants $90,000 back. And one of the first questions I ask is, have you read the policy from the insurance company that has been paying you hundreds of thousands of dollars? No, I didn't even know there was one, Dr. Kotlar. No, I've never read it. See, I don't know. It's not good. You have to be proactive. Read the policies. Members of Target Coding listening to this, you know the deal. We provide you with the policies from the insurance companies that you bill so you could see what they require. Do they require a re-exam or not? Do they pay for headaches or not? Do they pay for sprains and strains or they don't? Do they pay for treatment of asthma, allergies? Do they pay for treating children? See, just because you get paid doesn't necessarily mean everything was done right. I mean, I'll give you a very blatant example. You bill the insurance company. How does the insurance company know the patient was even there? Right? So you can bill whatever you think is right, and you get paid, and you think everything's okay just because you receive payment. It's not that simple. Understand the what and the why. Step 5, what is your CPT codes and why are your diagnosis codes? They have to match, link, pair. They have to be clinically appropriate. And if not, you'll have to give money back. So this is one way to pair your diagnosis codes. Seek out help. Get a book. Speak to people. Speak to your state association. You can't get anywhere then. Here, look at this. This is a page out of the book I was referring to. This shows you how to pair your diagnosis codes. This is just one example. The book gives you 25 different examples. 110, 112, 140, 530. Step 6, do a self-test on your soap notes. Make sure you know what a medically necessary soap note looks like per insurance company, right? Because each insurance company has different recommendations and requirements as far as soap notes go. Blue Cross Blue Shield requirements on documentation are different than Medicare. Medicare is different than PI. PI is different than Cigna. Cigna is different than Aetna. Step 7, attend seminars, webinars on a regular basis. Always keep learning. Step 9, put together a simple billing and coding compliance manual. Example, explain why you adjust full spine, but you're only billing 98940, right? A lot of you do that. Patient comes in, activated doctors, listen to this. Upper cervical doctors, listen to this. Patient comes in. So let's say you're an activated doctor. Patient comes in with neck pain. Aren't you checking the feet? Is there a possibility you might adjust the ankle, the knee? Wait a second, this patient only has neck pain. And your notes show adjusting the ankle. An insurance company can go, why? Why didn't you bill us for adjusting the ankle? Why are you adjusting the ankle? The patient only has neck pain. So make sure you have a policy on why you do that. Conduct regular meetings, especially with staff that are in charge of billing. Also do a spot check on your billing company. Just got another one yesterday. Doctors being audited for excessive use of certain modifiers and E&M codes. He didn't even know his billing company was adding modifiers to CPT codes. He didn't know until he got audited. So if you're using a billing company, do a spot check. Make sure that they aren't adding codes and modifiers without your approval. Do that, just in case you get a knock on the door. Do this so you could SWAN. That's my favorite acronym, SWAN. Stands for Sleep Well at Night. So just a few closing comments. Please check with all the plans prior to billing. Make sure it's compliant. Thank everybody for attending. Here's my contact information, Dr. Kotlar at targetcoding.com. There's our website, telephone number, fax number. We're on all social media platforms. You'll find us. Go on Instagram, go on Twitter, like us on Facebook, check out our YouTube channel, put in Target Coding or my name, you'll find our platform. We give out free things, we give out specials. Now, besides these webinars, we do a lot of other things here at Target Coding. We do seminars, we sell videos, we do on-site consulting, we have membership programs. Hey, we even have hourly consulting. You want to pick my brain for an hour? We can do that. We sell forms, letters, templates. We provide HIPAA compliance programs, Medicare billing and coding programs. These are all mandatory things, by the way. We're going to be doing I've always wanted to do a seminar on a cruise. So here we go. March 29th. Oh, no, March 28th. March 28th through April 1st. It's 4-night cruise. It's a seminar on a cruise ship with 8 CEUs. We've applied for CEUs in, I think, 30 states. So we've been approved in most. Some are still pending. But this is a cruise and a seminar. Bring your friends, bring your family, bring your entire office. It's one fee for the entire office. So you're a doctor and you have 15 CAs. All of you can come to the seminar for $149. $149 for the seminar. We've locked in an amazing group rate. Contact Vicki. There's her phone number, 954-349-7444, 954-349-7444. Ask for Vicki. We have an amazing group rate. Depends on what cabin. You want an inside cabin, you want a balcony, you want just an ocean view. There's all different types of choices. There are 22 bars, lounges, and clubs, family-friendly activities, laser tag, rock climbing wall. It's 4 nights, so it's not that long. It leaves on a Thursday. You're back on Monday morning. 8 CEUs approved. And the other things we do, we have something called our Smart Choice program. This is just a quick evaluation. It's like, hey, here's my car. Check it out. Let me know what's going on. Give me a report. So our Smart Choice program, send us your notes, your fees, your codes. We do a complete analysis. We probably takes about a month or two to go through it. We have a few phone calls. I tell you what I like, what I don't like, and you're on your own. That's it. It's a quick audit, evaluation of your practice billing, coding, and documentation. Here are the forms I was referring to. 75 chiropractic, physical therapy, acupuncture, Medicare, and HIPAA forms, logs, and templates. They're categorized by new patient forms, financial and admin forms, exams and treatment plans, tons of different sample soap notes, tons of letters of medical necessity, appeal letters, fight back letters, some physical therapy forms, acupuncture forms, Medicare ABN forms, sample Medicare notes, plus 23 HIPAA forms and logs. We are often asked, who do you recommend for billing, Dr. Kotlar? We recommend ACOM Billing Services. They also sell software, but we recommend them for billing. We actually put together a special. Our partnership with ACOM, you get an evaluation. It's a $1,000 value, free billing analysis, free setup, 50% reduction on the software, and optional free online patient registration. This is the book I was referring to. Great FAQs in the book. This shows you how to pair your codes with the codes that pay for the most visits. Cheat sheets, manuals, billing and coding manuals, a disgruntled employee, unhappy patient, even a jealous chiropractor down the street can file a complaint against you, could submit a complaint to the state board, and then here they come investigating you. If you have a billing and coding compliance manual with policies and procedures that you're following, nobody could accuse you of any wrongdoing. I mean, they could accuse you, but they won't get anywhere. Acupuncture billing and coding manual, Medicare billing and coding and compliance manuals. We sell them all. HIPAA. We're also putting together an OSHA compliance manual. We're going to have it all. Memberships. So again, I want to thank everyone for attending. Again, here's our contact information. Let's go ahead and take a look at the questions that have come in.